Recent death of a Kailua toddler after visiting a dentist has shocked the dental community. The Hawaii Dental Association released a statement today saying that the practice of sedation and anesthesia by licensed dentists is regulated by the state of Hawaii and to ensure the highest safety measures for patients undergoing sedation. We also encourage the public to speak with their dentists and to feel free to ask questions about their background and credentials, treatment plans, and treatment options. The recent tragedy is raising concerns over pulpotomies, essentially baby root canals, and whether it's a necessary procedure. Dentists are hoping that parents ask the right questions about the treatment. 3-year-old Finley Boyle died last week after lying in a coma for weeks. Her parents claim a visit to Island Dentistry for Children run by Dr. Lily Geyer last month left their child brain dead.
We were all hoping. I mean, even the PICU doctors are in tears. I mean, they all have children too, and we're all just waiting for her to wake up.
Dentists like Dr. Cecile Sebastian say cases like this are rare.
A very, very small percentage only is done with either conscious sedation or unconscious sedation.
Sebastian has been practicing dentistry for more than a decade. She emphasizes there's a huge difference between local and general anesthesia and that most visits to the dentist involve the former.
Local anesthesia is administered specifically to an area that is going to be treated, and that is what most dentists do deliver. General anesthesia is where more drugs are administered for the central nervous system and patients are actually unconscious.
Details of Finley's visit to the dentist are still unclear. Calls to Island Dentistry for Children were not returned. But the Boyle family's attorney alleges 5 different doses of sedatives and anesthetics are to blame.
It appears as though most of the work that was said to be necessary by Dr. Geyer was in fact not necessary.
Finley was undergoing multiple pulpotomies, which dentists say are common and often necessary.
Baby teeth are still very, very important as far as maintaining bone space for the child's permanent teeth to develop properly. If a child is already suffering from a cavity and it's into the nerve, more than likely it's a painful tooth. So a pulpotomy is done not only to save the tooth, but to also take the child out of pain.
And Sebastian says that it's important to keep an open dialogue with your dentist at all times, especially when it involves children who will be sedated.